our second class, and we'd like to have a quick review of the last class. In the last class, we have discussed about the purpose of writing. That is one of the criteria in the marking. In purpose of writing, first and foremost thing is like the recipient to whom you're writing, and secondly is the issue, like it's referral, discharge, update, request, and so on. Second thing is your content, that is selection of relevant case notes. You have to select the relevant case note as per the importance. The third is your organization of the information. You need to organize the information, wherever in appropriate sequence. And fourth one is conciseness and clarity. You have to write it down the letter in a concise and clear manner. And then we have your genre and style, which you can see that you have to write it down the technical language, followed by the language component. So according to the provided information, you have to write it down. You can say the letter. These are the 6 points. On the basis of these 6 points, you need to organize your writing task, right? Anyhow, so we like to start the class now. And here we can see that we have certain things which include your types of letter. Now, in type of letter, the first type of letter we can say is your the letter of referral with diagnosis. So if you can see there, let's say if we are writing a letter with diagnosis, so in that case, we do write it down the exact diagnosis that has been given to you. That we can say is a kind of referral letter with diagnosis, right? And we have also let's say different cases in a referral letter, but it's comparatively easy. Followed by the second point. Now we can see the second point in a letter when we have to write it down without diagnosis. When we are writing a letter without a diagnosis, there is a symptom or history being given. We have to write it down, that letter, without diagnosis, without any symptoms, right? Then we can see it's a letter of referral without a diagnosis, right? So in a letter, when we don't have the diagnosis being given, so in that case, you have to, you have to mention this thing. It's your the same symptom that has to be written, right? The same symptom that has to be written is your letter of, we can say, uh, uh, referral without diagnosis, right? Okay. So this is your, like a letter that we have to see, followed by the differential diagnosis. In a differential diagnosis, if you can see there, we do have different diagnosis being given, right? We do have different diagnosis being given. Like say, if we have the primary issue, for example, such as abdominal pain, and then we have two suspected condition, it's also come under the differential diagnosis. We also have a situation, let's say obstruction. Then we have to see it's your diverticulitis or carcinoma. Second scenario is that, followed by the inflammatory bowel disease. We also have a suspected diagnosis of Crohn's or ulcerative colitis. This is, you can see there, is your, a reason to write it down, the referral letter, right? Anyhow, so afterward, you can see there, we have, we have two different diseases such as AMI or APO. These are two different diseases that has to be followed. Okay. And secondly, we have, we can write it down introduction in this way. I'm writing to refer Mr. XYZ. Let's say I'm writing to refer Mr. XYZ, whose sign, symptom, and investigation are suggestive of an early bowel obstruction, secondary to diverticulitis, okay, and carcinoma, okay. That is followed by the second letter. Thank you for seeing Mr. Alex, whose features are suggestive of acute pulmonary edema or acute myocardial infarction, right? It should be written in this way. If we have two differential diagnoses, when we have three differential diagnoses, we can simply write down the three condition. Okay. Beside that, we also have a condition which includes your maybe we have more than like 4, 5, 6 diagnoses in the real exam. We have such scenario. We have 3, 4, or more than 4 diagnoses being given. So in that case, we can just simply write it down, the diagnosis as it is. No need to mention anything differently. Simply write it down, that thing as it is, right? Anyhow. And in case of differential diagnosis, you have to write it down, your symptoms. You can write it down, the symptom as well, in the differential diagnosis. Okay. So if you can see there, this is a kind of differential diagnosis letter. It's a third type of referral letter. So we repeat it again. The first letter of referral, when we have the diagnosis being given clearly, you can just write simply the given diagnosis. And if in the letter of referral, again, we have sometimes symptoms being given, there is no diagnosis, just a symptom. It can be tricky at that time. We even have the vague situation, a situational letter. It's not even the symptoms, such as we cannot write on the symptom directly, but we have some situation, let's say unresponsive to the treatment, and patient is having different belief. That's why he's not taking the medication. So according to the situation, we have to see accordingly. We need to address the letter in without diagnosis. Letter of differential, we have different category in the differential letter we discuss as well. These are some example that has been done for you with different example of your differential diagnosis. How we can write down the introduction. I'm just discussing about the type of letter with reference to your introduction, right? Anyhow, followed by the discharge letters. So discharge letters, commonly we'll be discussing only about the medicine letter, forget about the nursing. So in case of discharge letter, its simple concept is your follow-up. So normally in case of medicine, the follow-up is being written to the primary care physician. It's understandable that we have to write it down, the letter of discharge, to the primary care physician. And primary care physician has to ensure the discharge plan, right? He has to ensure the discharge plan. So in a medicine letter, 99% of the time, social history, family history, past medical history will not be relevant 99% of the time, right? However, at time, not necessary. At time, it can be relevant. At time, I will show you a letter today where we have to see maybe socioeconomic detail would be relevant. Even if you would be writing this socioeconomic details, we must have a clear logic or reason behind that, like if it's relevant or not. Anyhow. Afterward, we can see that the structure is conventional structure of writing a letter of discharge. What I mean by the conventional structure is at the time of discharge, when we are standing on the discharge day, it is important for you to understand that the information that has been given to you in the ward stay, there's a possibility there that they would have written something in very detailed form, but you need to keep that thing in your mind. It's not necessary to include each and everything. We have to just write it down, the main or key features of the ward management. Do not include each and everything, but the key feature of the ward, right? So basically, important thing is that we have to include the key feature of the ward, right? Anyhow, so afterward, you can see that rehabilitation, though we can summarize, like the information in as much summarized manner as you can, and at the same time, you have to, summarize the rehabilitation management or the nursing management. But again, do not miss any key point in just the view of the summary, right? Do not miss the key point just to summarize the information. Anyhow, afterward, we have to see that we have discharge plan. So in discharge plan, it's important for you to explain each and everything in detail. It's important for you to explain each and everything in detail. Okay. Uh, Sometimes we do have very limited information in the discharge plan. So it's your language skill to do, expand or summarize. Okay. So I believe it's clear to you. If you do have any question, please feel free to ask me. And here is the way you can write it down. Your, let's say, letter of discharge. And this is introduction of the letter of discharge. I'm writing this letter regarding Mr. XYZ, for example, who has undergone successful right knee replacement surgery and is being discharged today into your care for further follow-up. So we can write it down the discharge in this manner, right? You can write it down the discharge in this manner. Okay. So I hope it's clear to you. If you want to ask any question, please feel free to ask me at this point of time before we can. While writing a letter of request, while writing a letter of request, it is important for you to understand that this can be written in the referral format or the discharge format, right? This can be written in the referral format or the discharge format. In both of the format, you can write it down, the letter, right? So in this way, if you can see there, we have the letter that we can write it down to the occupational therapist, right? We have a letter, we can write it down to the physiotherapist. We can also have the in letter, if you are writing this letter to the social worker, you can also write it down this letter to the maybe for the eligibility of the pension care, for the home placement, and so on. So you can also write it down this letter to the genetic review specialist, right? So if you can see there, if you can see there that these are some of the possible ways that you can write this letter. These are some of the possible ways of the different type of letter that you have to see. It can be in the referral or discharge category. Let's say we are writing this letter to the occupation therapist. You know, it can also be written to a physiotherapist and so on, right? So basically, this is the way how you can write it down. If you like to ask any question in there, please feel free to ask me. So the main focus you need to understand to the main focus is to you need to understand the purpose of writing or the main concern that why we are writing this letter or the person to whom you're writing. You have to understand what is the role of that person. Like we should know the role of physiotherapist, what the physiotherapist will do. This is the role. Okay. And secondly, if you can see there are some different type of letters such as letter of discharge. We have letter of transfer. In the letter of transfer, you have to see there is an outbreak of in the letter of transfer, we have to see that we have low to high stream, like from emergency to ward. Okay. And we have the we can say side to mainstream, such as if you're a field doctor, no, you're writing to the to the mainstream doctor to any hospital setting, from the ward to emergency. We can also have the confusing words such as one-way transfer. Okay. We have one-way transfer. Uh, but as you can see that, transfer to hospice care is your one-way transfer. Transfer to hospice care is your one-way transfer, right? Transfer to maybe nursing home to nursing home is also one-way transfer. Transfer to, from one person to other person, like GP to GP transfer, is your one-way transfer, right? So basically, you can see there, these are different format of transferring a letter. Though transfer letters mostly, we can say it's the same as your referral letter, but they will confuse you by adding one-way transfer or complete transfer or relocation or maybe something like that. They might confuse you with these things, like you are transferring the patient like write a one-way transfer letter to just get you more confused by writing this way. Write a one-way transfer letter, right? In this format, you can see that though you have to take the concept, the one-way transfer is there is no coming back, such as hospice care or the palliative care, such as from one GP to other GP, you are writing this letter. From one GP to other GP, like old GP is writing to new GP. So we have to see this is your, you can say, kind of a transfer letter, but from one person to other person. So we have to see that how can we organize the information accordingly, because most concern is the reason of referral. Transferring for the temporary shelter is also an example of one-way transfer. If you are writing this letter to the, you can say, permanent transfer, right? So here you can see that these are a few examples of letter of transfer. As an example statement that has been done for you, I am transferring Mr. Mark to your hospice care as he is on the terminal stage of cancer and he needs your further palliative care. This is an example of transfer letter. Followed by the education letter. Less likely, the education letter, less likely, the education letter you could have in your medicine, but still, being a general practitioner, you could be writing this letter to the parents regarding the outbreak of any, disease. You can write it down, this thing, we can say, to the parents, right? So afterward, we have, let's say, just a minute, please. This is a kind of education letter we can have in your, you know, in your medicine. The less likely we have this information, right? So after that, we have the, you can say, information letter. Information letter is normally being written to the health ministry, right? There is a spelling mistake in that. Normally, this being written to the health ministry. So this is your letter of information. Anyhow, so let's say if you want, it's about introduction, and now the body of the letter, right? So in the body of the letter, this is a general layout. For example, introduction, we should write it down 25 words. Maybe in the body one, we can write down the 40 words, body two again 40, body three 70 words. But this should not be kept as a standard structure. According to the, like provided information, we can change the information. So based on relevance, we have to prioritize or we have to, like summarize information just based on the relevance. So in medicine, mostly we don't write down the medicine or the past medical history in case of discharge letter, right? So this is your just general layout, but we have to be flexible as per the case. Now, in the paragraph structure, first and foremost is the topic sentence that we should have to keep in our mind, like according to the topic sentence. You have to write it down the main idea or the chief complaint or the presenting complaint in your own words, not the words of the case notes. You should not use the word of the case notes, but word of the case notes has should not be used, but you have to use your own words, right? Anyhow, followed by the supporting sentence. Supporting sentence is the description of your symptoms, any major medical trends. You need to paraphrase those statements, right? You need to paraphrase those statements. Changing the form of the word from noun to verb, right? From adjective, from noun to adjective, let's say, and so on. So accordingly, you have to transform. Your transformation is an important element in structuring your paragraph. Then use of the, let's say, signal words that can indicate the change in event. For example, at the time of admission, let's say, at the time of discharge, during hospitalization, despite inspired, although, and so on. These are few things that you must have in your writing task because it will bring the clarity and coherence at the same time. Then we have the body of the letter. In the body of the letter, you can see there, these are few examples. Any one of you can transform this case note for me right now. Oh my goodness, they have to see that. And if you can, case notes can be transformed like in three format as I've done. We have, you can say some of the answer. I'll read it afterward. Initially on 1st January 2019, Mr. James reported, so transformation is important. 2 week history of mild persistent pain, change of the word, persistent abdominal pain, which aggravated. You also use words while sitting or bending. Then let's say if it's 2 months back, let's say if this date is 2 months back, so we can write it down. 2 months back, Mr. Mark presented with a complaint of chronic mild abdominal pain. However, it intensified if he sits or bends. Mr. Mark James had moderate abdominal pain, which was continuous in nature, and worsened when he sits or bends. So, few of the example that has been given to you, so that you can understand that how can you translate it, right? Now we will see a detailed discharge plan. Like we have to read this thing quickly, and after reading this thing, we can go on the next slide. That is your structure of rehab, and then we have the discharge plan. And how can we see that we have summarized? But I will give you some time to read. Let's say the patient presented to the ward following right total knee replacement. Vitally, the patient was stable. His blood pressure was, let's say, this one. Pulse rate was this. So as you can see, if it's normal or not. Patient was having good observation. Hemoglobin level was low. Therefore, you have done transfusion. Then we have done given some medicine. Let's say then painkiller was given, morphine as effective. On the next day, we have some management in the ward with some change in medicine, right? We have to see that. Then again, the next day, we have some other medicine management or the ward management, removal of clips, let's say dressing wound, all right? Then we can say the patient start walking on this date, followed by the glycine you have changed and X-ray finding and so on. Anyhow, we have to see these are the ward detail. You will read it in detail. Right total knee replacement. RTKR mean right total knee replacement. Now just observe it. I don't want to write it. I will show you the transformation tool. Then we'll see how can. Like it's normal. Pathologic mean normal. Everything was normal. Now we have letter structure of rehab. In the structure of letter, you can see the rehab things. You can also read it. Afterward, we have a discharge plan. Uneventful mean good recovery, yes. There was nothing significant. Full blood examination. FB stand for full blood examination. Now we have to see over here, FB stand for full blood examination. Now we can also see, let's say, the tool that is being required for the transformation. Let's say, which tense should we use for the transformation? Here, let's say we have what state, we have the past history or so on. Then we have sentences. We can use simple, compound, complex sentences. Okay. And followed by the clubbing the information, like write down the similar information together. Like if you can see, there might be some information written at anywhere in the in the task, right? So we can write it down together. INR stand for International Normalized Ratio. Okay. This anyhow. So then we can see that, let's say these are some of the transformation tool. All these vitals, circulation was good. We can just write down unremarkable. This sign we can use for increase. Let's say blood transfusion, we can use, let's say, therefore, for this sign over here. And uh, good is sign mean good or positive. RO mean removal of. SC means subcutaneous. NAD mean no abnormality detected. Many in the morning, nocte at night. QDS 4 times a day. PRN as per required. With home, WM mean with home. Okay. And personal hygiene can be replaced with hygienics or domiciliary care. So let's say we can see that these are three of the possible transformation as per the information. There is a possible transformation as per the information. We can write it down. First of all, you have to see there, like this. If you can summarize, is as it as much as you can, like a period of 9 days, comma. His stay in ward was uneventful, except blood transfusion due to low HB. Okay. Okay. Then we can see that he had an info. If you want to, you can say summarize. Like you have to summarize. If you want to expand the discharge plan of the ward stay, we can see it should be written in this way. Like in that manner. For example, you have to expand it. Okay. Afterward, we have to see, like the third format of summarizing them down. Mr. Mark's stay in ward and rehab remained uneventful. He had been transfused with blood due to low HB. And the rehabilitation program, which includes, let's say, full exercises, frame, and trial of shake while walking, help the patient to make him gradually independent in terms of mobility. Right? So basically, these are a few of the examples that has been done for you. And now we can see the discharge plan can be expanded. The discharge plan, okay, can be extended. And this is an example to write it down the discharge plan. Okay. Okay, anyhow. So we can see that how can we write down the discharge plan. The body of the letter can be written in this way. So, any example that you want to see discuss? Anything that you want to ask, please feel free to ask me.